Parent's Guide to Child Development. I'm your host, Anna Marie Von Furley from Fledgling's Flight. Each podcast, we strive to give parents the tools they need to help their child thrive through conversations with experts in child development and psychology. Today, we're talking to Dr. Kacee Stevens about DMI therapy. Kacee Stevens, PT, DPT, is a board-certified clinical specialist in pediatric physical therapy. She graduated from Brenau University in 2019 with her doctorate in physical therapy. Since starting her career, pediatrics has been her primary practice, but she also has some experience in geriatrics. Kacee has experience treating genetic syndromes, ASD, Down syndrome, torticollis, surgical repairs, cerebral palsy, developmental delay, and much more. Kacee's also certified in the TheraSoup method for intensive physical therapy and DMI introductory level A and B certified. In her free time, Kacee spends a majority of her time doing outdoor activities with her 2 kids, husband, and 4 dogs. Welcome, Dr. Stevens. I'm excited to talk to you about DMI therapy.
Hello.
Hello. Okay, so for many people who are watching this, they're thinking, what is DMI therapy?
So basically, DMI stands for Dynamic Movement Intervention. It's all the new rave right now with pediatric PTs. OTs also can take the course as well, and implement this technique. It is basically just a manual technique. We place kids through certain exercises, and we seek some active and independent postural responses. So.
What do you mean by postural response for those people who might not be familiar with that term?
So, typically we use these kind of interventions with kids that are lower tone, kids that just have these abnormal movement patterns. So we facilitate an appropriate or a correct movement pattern, and we want that more typical response that, more typical developing kids show.
So by movement pattern, are you talking about like walking or standing or just even like moving their arms or for
Yes, it could be anything. It could be rolling. It could be sitting up. It could be, like an actual true sit up, a sit to stand. Yeah, it could be anything.
So is it that these children are still hitting those milestones, but they're getting to them in a different way, and what you're trying to do is show them the more typical developmental pattern?
It can be. It can be. You can certainly use the techniques on kids that, yes, are stepping up on a step, but doing it a little funky. But it's more geared toward those kids that aren't aren't necessarily sitting up by themselves, or the more developmental delay.
Okay, gotcha. It sort of dovetails my next question. Is like who is it for? Who does the DMI therapy?
So we so many diagnoses can benefit from it. It could be cerebral palsy, it could be genetic syndrome, Down syndrome, just developmental delay, no really known answer yet. Um, just low tone. I mean, the list goes on and on. So,
Does low tone mean low muscle tone?
yes, low muscular tone. Yes, yes.
And then how is it different than typical therapy?
It's a very hands-on, um, hands-on intensive type method. Um, you know, s- Depending on the level of cognition and other things, communication levels, sometimes typical therapy can just be, hey, let's do this obstacle course. And it's not so much hands-on, like, "Hey, let's step up." So that's your more typical method, whereas the DMI is more intensive. It's like, "Hey, we're gonna do these 5 reps of this specific movement." It's whole body, it's hard, so very hands-on compared to other modalities, other techniques.
By hands-on, are you guiding them through a more typical movement?
Yes, yes, like truly hands on the child, moving them through space, exposing them to gravity. Yes.
Fantastic. So what types of exercises are included in DMI therapies?
So they come when you take the course, there's this huge manual of exercises. I'm not allowed to share them, but but it,
Word.
it could be, I mean, there's there's several alternatives to each exercise. Um, for example, if you want to just do a true sit up from midline, or you could sit up kind of rocking to the side using your arm to help you push sit up.
Mhm, mhm.
So it's just depending on the exercises. There's several alternatives to each one.
So what does DMI focus on?
Um, it it focuses on stability, right? We need stability to move our arm. We need stability to stand up, all these things. So it focuses on stability of the core. Once you get that stability, then you are able to have mobility.
Yeah.
Um, so yeah, it's stability to activate those postural responses that we're looking for that I mentioned earlier. So,
So does it focus in our app, Fledgling's Flight, what we do is we have 6 different developmental categories. So gross motor skills, fine motor skills, cognitive, social, emotional, sensory, and communication. Like, I always
mhm,
forget the one, like, which one did I forget?
yeah.
And so does DMI focus on a particular developmental category, or is it sort of go across developmental categories?
So it does focus on gross motor,
Okay.
but for sure, in physical therapy, just generally, you typically see as gross motor skills develop or as kids get stronger, other areas start to develop as well, whether it's speech, feeding, feeding gets stronger because your core got stronger. Um, Fine motor skills get better because your core is stronger. So it focuses on gross motor for sure, but other areas of development see positive effects as well.
And for those who are not familiar with gross motor skills, how I describe it is that it's your deals with the large muscle of masses in your body that'll help you not you, well, I guess you, everybody,
Yes.
crawl and sit up and roll over and run, and whereas
Mhm.
fine motor skills focus on hands and fingers particularly. So really you're working on these gross motor skills, building those core strengths so that the child can sit up and do meet their mile can't talk meet their motor skills that
Yeah.
they should, so that they get follow the same developmental trajectory as typically developing children. Uh,
Yes. And I say that, OTs can take the course as well. OTs typically um, focus on your fine motor skills. Um, so even though it is gross motor from an OT aspect, when they take the course, when kids are very young, a lot of what PTs and OTs do can look very much the same. Um, but OTs can take it from, okay, hey, I'm focusing as a PT on the sit up portion. Whereas the OT can take it as, hey, we're going to weight bear through this hand because that strengthens the hand, right? And your arm and so forth. So it's gross motor, but it's a little bit of everything.
yeah, well, connections in the brain are connections in the brain. So
Yes, sure.
and I think you talked a little bit about this, but maybe you can add a little bit more information. Can DMI therapy techniques be used in conjunction with other therapeutic techniques?
Oh, yes, for sure. I myself have not taken this course yet, but there's a lot of therapists out there that are, doing e-stim, the electrical stimulation on the muscles with these same X DMI exercises. Um, that's probably a big one right now is the e-stim. But yes, for sure. And it doesn't have to just be DMI in sessions. We could do DMI exercises and then go to your more typical exercises. So yes, it doesn't have to just be DMI.
Can you talk a little bit more about the electrical stimulation of the muscles?
Yeah, so what it is um you have these little electrodes, little square stickies that you stick on your muscles, depending on what muscle you're trying to fire, right? You find that, you put it on. And the e-stim machine, very, very light stimulation. We're not shocking anybody or anything like that. Um, but basically you turn on the machine to a certain level. We we focus on that what is the term I'm thinking of? Overstimulation, right? We want overload of muscles
Okay.
in order for them to grow and strengthen, right? So that's basically what e-stim is.
It's to stimulate those muscles so that in a certain way so that there's a connection, a neural connection made in the brain.
Yes, so that they can fire.
Okay.
Um, you know, the research on e-stim is not always strong, as far as it making a true permanent change in the brain, but it is certainly something that it's another tool that we can use. Um, hey, I want this muscle to fire so that we can stand up better, so it is a tool, it strengthens what we do, but the research is a little weak on true neural changes. So,
So
yeah.
this sort of like makes me think of like primitive reflexes, and what I mean by those is that they're when a baby's born, they can't do anything with their body. Everything that they do is a reflex that keeps them alive until they can figure out how to operate their own bodies. And so what it sounds like to me is what's happening is the primitive reflex hasn't been integrated and replaced with intentional movement. And so what you're trying to do is stimulate a specific muscle in order to engage it so that these reflexes get integrated and replaced by intentional movement. Is that, am I interpreting that
You
correctly?
are perfect. You're right on the dot. Yep.
Okay. Fantastic. Have a big soapbox of primitive reflexes, and when they
Sure.
don't integrate, like they have lifetime effects, and it's
Oh, yes.
nobody knows about, but
And it
it can affect you for your whole life.
for sure.
Yeah. So yeah, and then another shocking revelation I had with another PT was like, oh, and by the way, they can come back again. Like they can be re-triggered by
Yep.
trauma. I'm like, no, no.
Like this endless cycle we live in. We don't really have control over ourselves. Yeah.
Oh, amazing. So how do you determine if DMI therapy is right for a child?
So that when you take the course, they provide you with this assessment tool, right? That lists out all the exercises, and it gives different grades, 0 being no active involvement at all, whereas a 3 is, hey, they're completing the movement all by themselves. Um, so there's the assessment tool. Um, you can start to do some of these exercises and say, hey, this is working for this child, or this is not. The thing with DMI is sometimes we get these kids that are very, very, very low tone, or these kids that have these really stubborn primitive reflexes, or just these really hard atypical movement patterns, that have been really hard to break. And so it does take time, right? Like any exercise, if you go to the gym once a week, that's not going to do anything. you know. So it does take time for sure. Um, whether you say, "Hey, I'm just going to keep trying this and hope that I get an active response," or, "Hey, this is not quite working, let's try a different exercise." Um, so with my kiddos, whether I question whether it's going to work or not, the biggest thing is time.
Mhm.
Biggest thing is time. And,
So, oh, sorry, complete your
I
thought.
was just gonna say, DMI is just another tool in a therapist's toolbox, right? It's not gonna work for everybody. Um, and then that's just when you pick in your PT brain and say, "Hey, we're just gonna have to try something else." So,
Okay. So would it ever be appropriate for maybe typically developing children or kids that have just a little bit of a delay, but not like a more profound delay?
oh, yes, for sure. I'm currently treating a girl, no diagnosis, um, just delayed. I mean, she's turned 2 and wasn't walking by 2. She wouldn't even really stand. And so in that case, I did for sure use some higher level skills like, hey, we're just going to work on standing, right? And like I said, it's just a manual technique. Finding different levels of support but still making her work, right? I'm not just going to hold her hand, but hey, I'll give you some support down here at your legs. So for sure, you can definitely use it on typical developing kids that are just a little behind.
Okay. And then is it something that like my son ended up doing vision therapy when he was 9. So he would go in for sessions, I think twice a week, but then I had exercises I needed to do at home. Is it the same thing where the parents go home with sort of a list of exercises to do with their child so that it's like you said, not the once a week at the gym? Or do they come in and to your come every day to your
So it depends. There are different levels. Some kiddos we only see once a week. If we're lucky, we get to see a kid twice a week. Um, Depending on your level of expertise when it comes to DMI, there are technically 3 levels, plus 2 intermediate levels. I am only level A and B certified, and I'm waiting to take level C pretty soon, hopefully. And in that case, once you have levels A, B, and C, you can consider yourself a DMI intensive. And in that case, it would be every day for so many weeks, right, at a time. But yes, to answer your question, it is definitely we send home exercises. Hey, do this at home, try it at home if you're comfortable. It is definitely an everyday thing. Like I said earlier, exercise once a week, even twice a week, that's 2 hours out of your whole week is not going to make a huge significant difference, right? It has to be done at home too.
how do you determine if DMI therapy is right for a child?
Um, you know, I have a kid that I'm like, man, I wish DMI would work. I wish it would work for him. And I've been trying and trying. Some things I'm able to implement and some things I'm just not. Um, some exercises, first of all, let's talk about this too. Some of the exercises only work on a tiny baby. I
Oh,
mean,
right.
I, I'm 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 not weak by any means. Like I exercise myself. But some of the things I just can't do if the kid is a certain weight or a certain height. Um, so in that case, we are limited by if things are going to work for them or not. Um, the kiddo I was just mentioning, um he could so benefit from DMI, but he's really tall and he's heavy and he has spasticity. And so in that case, I'm kind of limited by what I can do with him. Um, but my other kiddos, like I said, I just try it and I try it again. Um, I don't think other than the kids that are heavier or bigger, um, I haven't seen any failure yet with trying to implement exercises. Like I said, it just takes time. So
So, barring the weight and having having the physicality to be able to move another person's body that's heavier than you or taller than you, it's for any age. It's not necessarily just for children. Is that correct?
it is correct, correct. For your bigger kids, if you're working on um some of these standing techniques that we use, it's safest to have a spotter with you. So
Right. Right.
yes, yes.
And I would assume that the sooner, like the younger the intervention, the better the outcome because the brain is more plastic in the first 3 years of life. It's making more connections more quickly. And then if you're starting the therapy with a 7-year-old, the outcomes may not be as profound as it would be if you had started with this particular child when they were 6 months old. Is that
Sure,
right?
there is no age limit as to when we can start DMI with a kid. Um, they teach in the course that you can start as early as 1 month. You don't need to wait until they're 1 year or anything like that. You're right. For sure, earlier intervention is able to make more plastic changes on the brain. So,
Amazing. So, what advice do you have for parents watching who think DMI therapy might be good for their child?
you know what? There are therapists everywhere out there. Like I said, it is the new rave in pediatrics. Everybody's taking this course. If you go to the DMI website, they have a list of therapists, per state and what clinics they're at. and you can seek out, your nearest. I think some states are still falling behind on therapists that are certified, but you certainly, and social media too has, you know, brought DMI into the world as well. Everybody's watching all these videos on Instagram and Facebook. Um, I would never try anything at home, right? Always seek out a certified therapist.
Yeah.
But yes, on their website, they list out all the therapists that are in your state, that are certified. Um, and I would assume that most therapists at least have some information they could provide parents with. So yeah, yeah.
Fantastic. So that leads me to, how do people get a hold of you? How do they follow you?
Yes. So I am actually on the DMI website myself, state of Georgia. I am on there. I have my own Instagram account. I believe it's Kacee_Stevens_DPT. Um, yes, those are my two main ways to find me. So
And so people could DM you if they have some questions about DMI therapy, or whether or not it might be appropriate for their child.
yes, absolutely. You know what? As soon as I started posting DMI videos, I'm still growing in the world of Instagram as well. I have my own personal account, but my PT account I just started not long ago. But as soon, it's crazy. There's so many families that are in need. And like I said, some of these states that are falling behind a little bit. I've had people reach out to me in New Jersey. One was one of the Carolinas, and saying that they can't find a therapist that's certified or nearby them. Um, so yeah, there's social media works.
Yeah, it's great way for people to sort of learn about things that they wouldn't know about in general. I mean, I wouldn't know about it without
Yeah.
without Instagram.
Yes.
That's how I found out about it myself. So
That's
yeah.
how I found out about it myself, so
Yeah. Oh, look, it's working. Yeah, that's
Yes,
one of the things that, we want to do with the Parent's Guide to Child Development. Is I feel like there's all this expertise caught in experts' heads, and we're trying to harvest it and then share it with parents so that they can learn from it. And so this is the reason we wanted to have you on today. So for those people who haven't stumbled upon DMI therapy, they would be able to, or if they're DMI curious and they saw and they're like, I want to know more, that this would be the way for them to do that. So thank you so much for your time, and have a great day.
you.